Thank you to Lancashire Care NHS Foundation Trust, who devised this animation and enabled us to adopt it for our use. Please contact innovation.idea@lancashirecare.nhs.uk if you want to adapt this animation for your own use.
Since 2015, something really positive has been happening at Nottinghamshire Healthcare. We are working to implement a nice public health guideline and going completely smoke-free from October 2016. This isn't a decision we've taken lightly, and it affects each and every member of our staff. We wanted to make sure that you understand why we are taking this journey together, so we can all be confident in getting to the destination. Smoking is the single biggest health problem in the UK and will kill 1 in 4 smokers between the ages of 30 and 69. This means that the choices you make today could help your service users live longer and healthier lives. As healthcare professionals, our patients already look to us for their healthcare advice. We don't give them alcohol, so why is smoking any different?
Okay, stop. I agree with you, but I don't know if I can actually do it. What about Bob, one of our inpatients? He looks forward to his smoking breaks. Isn't it cruel to take away that pleasure?
This is how Bob feels on a daily basis, right? He's not been smoking all night, so he wakes up really wanting a cigarette. His nicotine level is low and he's probably not feeling too happy at all right now. So this is during the morning cigarette break. Now his nicotine levels are replenished and he's feeling back to normal. But as the morning goes on, his nicotine levels dip and he's feeling bad again. But this time, no one is there to escort him. So he keeps waiting and waiting, feeling worse and worse, until you are finally free to take him outside. Isn't that cruel? To let Bob continue the cycle of craving and addiction?
Well, I guess so, yes. I never thought of it like that before.
What if you could help Bob to manage his addiction so that he never felt like that? It's the withdrawal from nicotine that makes him feel so bad. So what if he had enough nicotine in his body to stop that from happening? Smoking doesn't actually relieve his stress or calm him down. The nicotine only relieves the withdrawal symptoms caused by not smoking. We can use nicotine products to help manage those ups and downs, so that Bob doesn't have to worry about when his next cigarette break might be.
Okay, but what do I do if he gets aggressive when we can't go out for a smoke break?
The same thing you do when anyone gets aggressive. You have the skills and experience in order to de-escalate any challenging situation. Smoker or non-smoker, does it matter?
No, I suppose it doesn't.
And we're training staff on the wards as smoke-free champions, so that you can also provide specialist support to Bob, should he or you want that extra helping hand.
It's good to know the staff are all in it together and can support each other.
And in exactly the same way that we no longer smoke in pubs or restaurants, it will also just become accepted, and then Bob won't think twice about it.
That's true. I completely forgot. It used to be normal to have a smoking and non-smoking area when we used to go out to eat, and now it's just not.
Right, and you can still take him outside for a break and a chat. Smoking ticks many boxes, and sometimes it's not always about the nicotine. You might like to ask Bob what he would like to do during those times instead.
Okay, so what about e-cigs? I've heard that they are a healthier alternative.
Well, they've not been around for long enough yet to be certain of what the long-term effects of using them might be. But in 2015, Public Health England said they are likely to be 95% less harmful than smoking tobacco. The trouble is that unlike nicotine replacement therapy, they're currently unregulated, so it's not possible to know exactly what's in them. At the moment, the Trust has made the decision to treat them in the same way as smoking, but this is under constant review and may change as new evidence emerges. We do encourage patients in the community to use e-cigarettes as they try to stop smoking. However, certain unproven elements make them unsuitable for inpatient areas.
Oh.
Hey, but don't just listen to me. I want you to meet Kate, Harriet and Alan, who are inpatients just like Bob, and who have all gone smoke-free at the South London and Maudsley NHS Foundation Trust.
I used to smoke 50 a day and not one puff on a fag for 6 months. Just think what else I can achieve.
I feel so rich these days, the richest I've ever been.
For the first time in my life, I feel I can do anything.
Anything? That's really quite empowering, isn't it? Just one small thing. I smoke too.
You and Bob could help each other. And don't forget, your local Stop Smoking service is offering free expert support on nicotine products to help all staff and patients.
OK, well I feel more confident now. For Bob and for me, I'm ready to give it a try.
That's all we ask. And there might be bumps along the way and lessons to learn, but that's what reaching for excellence is all about. And it means you can really help Bob in hospital, Sarah at the podiatry clinic, or Lucy, your colleague. So please look out for your teammates, talk to your manager, and let's be the positive role models for our patients and the NHS. For more information, please check out the Smokefree policy pages on the intranet.
To contact your local Stop Smoking service, please call 0800 561 2121 for Nottingham City or 0800 389 7712 for Nottingham County.